is changing the way we live, work, and do business in Bermuda. It's also changing the way we shop. Here are some tips for grocery shopping during the COVID-19 pandemic. Before you go to the store, consider whether you really need to go shopping. If available, consider delivery options instead. Don't bring the whole family, as only one person from a household is permitted, with the exception of single parents. Don't go if you are feeling unwell or have symptoms. If you are a senior or in another high risk group, take advantage of senior shopping hours. Wear a mask or cloth face covering when going to the grocery store. Before going into the store, give your hands a good squirt with a sanitizer that contains at least 60% alcohol. Before you touch your card, wipe it down with an antiseptic wipe. Most stores are now offering wipes for this purpose. While you're in the store, stay at least 6 feet away from other shoppers. While you're in the store, touch as few things as possible. Touch only what you buy. Remember to avoid touching your face. At the checkout, stand away from the cashier and, if possible, use the card tap option to pay for items. After leaving the store, give your hands a good squirt with a sanitizer again that contains at least 60% alcohol. When you get home, remove your mask or face covering the correct way. Avoid touching mouth, nose, and eyes. Wash your hands immediately after removing. Rinse your produce. It's always a good idea, even when there's no pandemic, to rinse fresh fruit and vegetables with water to remove dirt, debris, and pesticides, and reduce levels of foodborne germs. Don't use soap on your produce. There's no need to use soap or chemical disinfectants on your produce. Wash your hands again after you unpack your groceries. Wash reusable bags. If you use reusable grocery bags, you should wash them after a trip to the store, either by putting them in the laundry for cloth bags or using soap or other disinfectants for plastic bags.
This is a message from the government of Bermuda.
Today, we join in mourning with the family and friends of those who have lost their lives to COVID-19. Yesterday's news of the passing of a resident of Westmeath is disheartening, and our prayers go out to the family and friends of the Bermudian whose life came to an end yesterday to become Bermuda's sixth victim of COVID-19. At our press conferences, we announced the numbers of cases, the numbers of hospitalized, and the numbers recovered. But behind every number is a family with hopes and dreams just like ours, and unfortunately, 6 families who weren't ready to say goodbye to someone they love. We are deeply sorry and saddened by your loss, and call on all of Bermuda to extend their prayers and best wishes to everyone who has been impacted and continues to be impacted by this virus. It has been the government's position that enhanced testing capability is a necessity and a priority. We believe this because that would better position the government to protect the health and safety of Bermuda and make informed policy decisions about how we operate during this pandemic and allow us to open our economy. With today's new results, they keep Bermuda as a leading jurisdiction tests, and also gives me the optimism that we will be able to start a very slow, and I repeat, slow, rolling back of our economic restriction next week. I am satisfied that the testing regime and criteria is reflective of the nature of this pandemic. And today we have the testing capacity and the supplies that we need. And it is noted that we are also making sure logistically we can handle this increased amount of tests. In fact, it is important to note that on Saturday and Sunday, 380 tests were performed through our new drive-through facility. This increase in testing has enabled us to provide many of our essential and critical workers with the reassurance that while they have been on the front lines, they have not contracted COVID-19. And I'm grateful for that outcome and for their service and sacrifice. Given the model that we have used for this testing, where we are running it through a government-owned lab, with the 667 tests which have already been processed or in process at the government lab, this is saving the country money. If this was done via the traditional method, via doctor's referrals and through insurance companies, the bill to the country for these tests would have been in excess of $200,000. But with the model that we have chosen, these tests to date have cost the government less than $20,000, which is a great savings to the country at a time when it is certainly needed. There is no denying the importance of testing, and this government will spare no effort to address this threat to our community with a rigorous approach to providing the invaluable knowledge these results bring. And now for an update on today's testing results and additional matters from the Ministry of Health, I will now turn it over to the Minister of Health, the Honorable Kim Wilson. Minister.
Thank you, Premier. Today, there were 388 test results received by the Ministry of Health, and one was positive for COVID-19. Also, as confirmed by the Premier yesterday and in my press release today, Bermuda has regrettably experienced yet another death related to COVID-19 over the weekend, and this now takes our total number of deaths for COVID-19 to 6. On behalf of my entire team at the Ministry of Health, I echo the sentiments of the Premier and wish to extend my sincere condolences to the family and loved ones of that particular individual. We know that you must be hurting deeply right now, and our sincere prayers go with you all. Bermuda now has 110 total confirmed positive cases, and their status is as follows. There are 60 active cases, of which 47 persons are under active public health monitoring, and 13 persons are hospitalized. A total of 44 have now fully recovered, and the total deceased now stands at 6. The average age of all of our confirmed positive cases is 59 years old, and the age range of all of our positive cases is from 18 to 95 years. The age of persons hospitalized ranges between 57 and 89 years, and the average age being 75. I can announce today that the Epidemiology and Surveillance Unit has begun collecting race data, and I can report preliminarily that 52% of the cases are Black, 39% are white, and 9% are unknown, and this reflects Bermuda's demographics. The ministry reminds the public that in compiling and reporting the statistic, we must bear in mind that race is a question that should be asked of individuals and not assumed. Persons also have the right to refuse to answer that particular question. We also must do our best to preserve privacy and confidentiality of persons diagnosed with coronavirus, and therefore, there must be enough aggregate information, such as the number of cases, in order to provide information in a way that would not lead to an inadvertent identification of any particular individual. On Saturday, I issued a statement regarding Westmeath Residential and Nursing Home, and I hope it managed to address many of the questions and concerns the community had regarding the timelines for testing at the care home. One point which perhaps I didn't make clear was that at the time of the first case, namely the 10th of April, we simply did not have enough testing swabs and VTM to be able to test all of the residents and staff at Westmeath. Public health action took place immediately, and the case was successfully isolated, protecting other persons at the home. Indeed, the subsequent cases found were unrelated to the first case. At that time, we had to choose between testing symptomatic individuals elsewhere and asymptomatic individuals at Westmeath. Going forward, I can say, now that we have increased the testing capacity, which you've heard the Premier speak about, we are actively testing all staff and residents in all of our residents' homes. I can confirm that we have tested 4 care homes so far, starting with the homes that had cases. All residents have been tested and staff continue to be tested, and there have been no additional residents found positive. We continue our wider rolling out of testing of all care homes. The issues of which care homes are first is based on a risk-based decision, based on fact, and it is in no way random. We look at risk factors to guide these decisions, such as the homes where there are a large proportion of staff who have worked in multiple facilities, or any homes with an epidemiological link to a particular case. This takes a careful exploration through contact tracing. Whether testing occurs in a home or not, the action which is taken is the same wherever there is a case. The wearing of PPE, physical distancing, contact tracing, and the isolation of ill individuals. Without implementing those steps, testing has limited usage. We also continue to test essential workers. We have performed approximately 229 tests to date for essential workers. I want to also address the damaging allegations being circulated regarding the government's new laboratory and Dr. Karika Weldon. As I have said previously, these unfounded claims of illegal or illegitimate testing are irresponsible and entirely false. They damage public confidence at a time that unity is paramount, and they risk causing wholly unjustified reputational damage to highly trained professionals trying to focus on fighting COVID-19. All testing done by the government is utilizing valid real-time PCR equipment and is FDA approved, and we will accept nothing less. They are being reported to our physicians, to the public, and to our international partners. And the government stands by the results of these tests, and we're pleased to have additional testing capacity. In closing, I would like to remind the public that hospital beds are still needed by the country. They are needed by the people who fall seriously ill and need hospital care. Therefore, I would like to reissue my call to those members of the public with loved ones at the hospital who are medically fit to leave. Please work with KEMH to receive your family members home so that all possible beds are available if the need arises. Thank you.
Thank you very much, Minister Wilson. And now the Minister of National Security will give an update on matters relating to his ministry.
Thank you, Premier, and good afternoon, Bermuda. Since April 6th, 184,000 stops have been recorded by the Bermuda Police Service and the Royal Bermuda Regiment at the community advisory points. This includes stops of this past weekend with 5,621 stops on Saturday and 4,426 stops on Sunday. As a note, the Royal Bermuda Regiment upcoming summer recruit camp has been postponed until the fall. Anyone interested in joining the fall recruit camp should call 238-1045 or visit bermudaregiment.bm/join-us. The Department of Immigration has had several inquiries from employers, agencies, and individuals with respect to passports, land applications, and work permits. To be clear, regarding our guest workers and work permit holders, I can advise that we are not asking individuals who are work permit holders to depart or leave Bermuda. That has never been said, but there are many in the hospitality industry who want to go home but are not able to do so. The unemployment benefit is only applicable to non-Bermudians if they are unable to leave. If non-Bermudians are unemployed, they do not qualify for financial assistance. In fact, we are working with all of our stakeholders to assist where we can. The public should be aware that each circumstance is different, and our team remain available to work through any issues and any concerns. Emergency medical technicians from the Bermuda Fire and Rescue Service continue to provide vital emergency services during the shelter-in-place period. Over the last 3 weeks, the fire dispatch answered a total of 520 calls for service. 409 were EMS related and 111 were fire related. The Bermuda Fire and Rescue Service also supported the British Airways air bridge flight with an ambulance and fire crews. Turning to the shelter-in-place approvals for businesses, altogether, the Ministry of National Security granted 105 businesses approvals to operate. These businesses have very strict guidelines. The public can visit www.gov.bm to see what businesses have been granted permission to operate. Any business that opens contrary to the emergency powers shelter-in-place regulations is liable to prosecution. Lastly, I wish to extend my thanks to the Bermuda Red Cross, who have been working in partnership with the government to provide valuable assistance. I was informed by the Red Cross disaster manager, Ms. Diane Gordon, that the Bermuda Red Cross has distributed over 62,000 surgical masks to those on our front lines and in our community. I would like to thank the Red Cross for all of their efforts. The Ministry of Public Works is issuing an advisory to our community about the proper disposal of protective face masks and gloves. We want to ensure that we keep our island clean, so we are ensuring commuters to keep a small waste bag in their car or under the seat of their bikes so that they can easily dispose of these items. Finally, this week, the Disaster Risk Reduction and Mitigation Team will be hard at work laying out a plan for the resumption and reopening of services. This effort will be undertaken with public health advice, acting in the best interest of the island to reduce the spread of COVID-19. We are working collaboratively with our private sector partners and our public sector colleagues in this effort. Thank you. Premier?
Thank you very much, Minister. Shelter in place is a health measure that was put in place to flatten the curve, which means reduce the number of people who get the disease at any one time. It is effective in suppressing the spread of COVID-19, and it saves lives and prevents our healthcare system from being overwhelmed. So far, this measure has succeeded, and our testing results today are showing that. But we must continue to make sure that our actions do not increase the spread of this disease. However, it is unquestionable that shelter in place has impacted the emotional, psychological, and economic well-being of many members of our community, and this weighs very heavily on the decisions of which the government makes. To address an aspect of the economic impact and how the government has addressed it, Minister Fogo will provide an update on the COVID-19 unemployment benefit, which was put in place as a bridge before financial assistance, and as the Minister of National Security has made clear, unlike financial assistance, is made available to those persons who are non-Bermudian here on work permits who are unable to leave the country due to the restrictions in place. Minister Fogo?
Thank you, Premier, and good evening to the listening and viewing public. Since last Monday, the Department of Workforce Development has received an additional 1,803 applications, bringing the total to 11,001 as of this morning. Since the launch of the fund on March 25th, 2020, some 5,008 have been paid the benefit, totaling over 7.7 million. I am aware that some are still waiting for their benefit and need access to these funds as soon as possible. I am pleased to advise that approximately 2,500 applicants who have not yet received benefit will receive their benefit tomorrow. These payments will total approximately 2.3 million. This is indeed quite an achievement, and I must thank my colleague, the Minister of Finance, and his team he assembled for pulling out all stops to make this happen. Those who have already been paid and remain eligible for the benefit will receive their next payment on Friday, May 1st. Workforce Development started this project with a staff of just 14 over 4 weeks ago, and now have a team of some 92 persons working on this project. They will continue to work diligently on this project and engage more resources as needed until it ends. I would like to thank them for their work and the dedication they have shown with staff working evenings and weekends to process the applications as quickly as possible. I am aware that many applicants have been frustrated in the delays of getting their benefit and equally frustrated with being unable to get through on the helplines. If you have applied for the benefit on or before April 6th and by Friday, April 1st of May, have not received any benefit or been advised that you are ineligible, please contact the call center for assistance. We have updated the call center to ensure that calls are routed to the next available customer service representative. Please call the call center numbers, which you've heard before, 297-7714 and 297-7716 during normal business hours. These have been upgraded to handle the volume of calls. The unemployment benefit form can be found at www.gov.bm. Emails can also be sent to unemploymentbenefit@gov.bm for assistance. Thank you.
Thank you very much, Minister Fogo. And just to reiterate what Minister Fogo had said, that those persons who qualify but have not been paid yet, the government will process those payments tomorrow, and they will be in your account either tomorrow or they may go in there overnight and be there on Wednesday. As I read this statement this evening, a number of committees are working on ideas and putting plans in place to rebuild our economy and to improve people's lives. We have reached out to the public seeking their feedback and ideas. And if you haven't already submitted your ideas, please visit forum.gov.bm. Over 100 persons to date have submitted their ideas, and I want persons to go there and to join the conversation. Vote for the projects or the ideas of which you think make the most sense, and so that we can actually have a conversation in a place where the persons who are going to be making the decisions on how we're going to move forward will be able to see these items in one place. Our ministers have reached out to the opposition, seeking their feedback and ideas, and earlier today, I've had a productive meeting with the opposition leader on how we can work together even better. We believe that no matter how talented, educated, or experienced we may be, during this unprecedented crisis, we are stronger working together, thinking together, and planning together to make sure that collectively we can build that better future. Tomorrow, the Cabinet will meet, and with the advice of technical officers of the Ministry of Health, we will determine the next steps post-shelter in place. We have observed the lessons of countries that have opened too far and too wide too soon, and we will not make those mistakes. Our solution must fit Bermuda, fit the cases of COVID-19 on our shores, and ensure that the health and safety of everyone is protected. That will always be at the forefront of all of the decisions that we make. We will be examining how far and we are able to get people back to work and back to their regular lives without jeopardizing the life and health and safety of our community. Let me be clear, we will not return to life as we knew it before COVID-19 for the foreseeable future. We must maintain social distancing and balance that with the opening of our economy and our community. The conversation in Cabinet tomorrow will not only be about how we can reopen our economy, but also how we can transform it. How together we can shape a Bermuda that will work for everyone. We do not have to be constrained by the limits of the past, and as is seen in the way in which we're implementing testing, which is saving the government a tremendous amount of money, we can do things differently and make sure that as we go forward, we take different approaches to our traditional problems. There are many in the community who have donated to those who are in need, and there are those who continue to assist our vulnerable. We are indeed all of our brothers' keeper and our sisters' keepers, and I want to thank each of you for your hard work and your dedication. We will emerge at 6 a.m. on Saturday, May 2nd, into a different Bermuda. Yet I am of the firm belief that if we work together, we will be able to survive and thrive in the post-COVID-19 world. I will end today on a personal note. This weekend, we saw the passing of the former Speaker of the House, the Honorable Stanley Lowe, OBE. As I said in my tribute to him yesterday, he was a man for all seasons. I appreciated the time that I spent with him, learning about his work, and also the significant contributions that he made to Bermuda. I extend the heartfelt condolence of the government and the people of Bermuda to his family. COVID-19 has changed the way which we do everything, even how we say goodbye to our loved ones. Instead of the customary condolence book, which would have been at the Cabinet building for Bermuda's first Black Speaker of the House and the longest-serving Progressive Labor Party member of the House of Assembly, we have created an online version. Those who wish to share fond memories and words of comfort for the family should go to www.remember.com/stanleylowe.obe.jp, and I will make sure that that link is posted to the government website. So you don't have to remember the long link. You can just go to www.gov.bm. Finally, I would just like to give a few thank yous this evening. I'd like to thank, in addition to Dr. Weldon, I would like to thank Dr. Kaiwan Brown, Dr. Amne Asaron-Fogo, and Dr. Cindy Morris, the Public Works team led by the Minister of National Security, the Honorable Colonel Birch, and happy birthday, Colonel Birch, the Permanent Secretary, Randy Rochester, and to all of the nurses and students that have been working at the testing facility at Southside for the past 4 days. They have put in long hours to make sure that Bermuda's essential and critical workers were tested over the weekend. 600 tests in 3 days is an incredible feat, and I just got a report that there's been 240 additional samples which have been collected today thus far. You are showing that determined Bermudians working together will get the job done and get it done successfully every time. If you are an essential and critical worker, I encourage you to get tested, and the link can be found on the government website. I would like to also express my appreciation to the team at Workforce Development, Minister Levita Fogo, the Permanent Secretary, the Acting Director, staff, and all public officers across the public service who stepped forward to form the Unemployment Benefit Project team. As I said many times, the government is not closed. The Department of Workforce Development does not have 97 employees, but there's 97 members of the public service who have pitched into that effort to make sure that it's happened. It has been a project that we started from the very beginning, but we have been able to deliver this relief, which is going to be much needed for many of our families during this time. What I will say is, while there is sadness in our community, we must also be able to celebrate our successes. The success of getting a program up like that running, the success of us moving forward so that we can have drive-through testing in this country so we can continue to maintain our leadership, our successes. And it's showing that not just the government, but all sectors of the community are pulling together to work together to ensure that Bermuda can be successful. With that, I'm happy to take the questions from members of the media. And as I understand, we have 5 media organizations represented today. Or is it 6? We have Bermuda Broadcasting, the Royal Gazette, Media Maya, Burr News, and also TNN. So it might be a very long question and answer period.
Good evening. Health Minister, you mentioned that all the other rest homes are going to be done a risk assessment on which one goes next based on epidemiological links. How many of the other 17 homes have links to them?
That information I don't have at my disposal. That's part of the contact tracing and the epidemiological links that's taking place as we speak. So the main thing I think that the main takeaway, if I can say, with respect to that is twofold. One is that all rest homes and seniors homes will be tested as a matter of priority, and we will prioritize the order in which they take place based on things like if there's been a link, because, for example, one person may have worked at several of the particular rest homes. So the reality is that, yes, A, all of them will be tested, and B, it will be on a basis of a risk rating.
With the overwhelmingly recent new cases having come from the two rest homes and the Airbridge Mercy flights, this has skewed the numbers by almost 1/3. If we set these cases aside as they are hopefully fully contained, is the government confident that the shelter-in-place protocol has virtually stopped further local transmission in Bermuda?
Mhm.
Thank you very much, Stefan. That's a great question. And I was actually up late last night doing a little bit of plotting of these things because I thought it was particularly interesting that outside the Airbridge and these cases at the rest homes, the level of community transmission which we've seen, or local transmission, not community transmission, they are two particularly separate things, has been rather low. When you will see the volume of tests of which we did today, recognizing, I think the minister reported 380 tests, and out of that, there was only one positive test. I think that confirms of what you said, that by and large, the shelter in place has managed to, as far as we can tell, control this, whatever limited local transmission was taking place. But as the minister has said, and as I have said repeatedly, that doesn't mean that we should, just open up entirely. I think it's a good step. I think that it's certainly something that is hopeful and will inform the decisions that the cabinet make tomorrow. But that does not mean that that doesn't mean that I'm going to be able to, I don't know, get my haircut on Saturday. I don't think that we're looking that far. But we'll make those decisions tomorrow based upon the evidence that shows. But you are correct in pointing out that outside of the Airbridge flights and the issues, the unfortunate issues in two of our nursing homes, we have seen limited local transmission since the shelter in place. So I think it has been effective in doing what it was supposed to do.
Other countries such as New Zealand, Australia, Iceland are working to eliminate the virus. They have managed to bend their curves through strict NPIs, but they were a few weeks ahead of Bermuda in the process. You said quite definitively that we were coming out of shelter of place on May 2nd. Wouldn't it be better to continue to shelter in place by 1 or 2 more weeks to set Bermuda up for a better longer term outcome?
I don't believe that that's as I said, we'll make the decisions tomorrow, but I have been very firm that there was one shelter in place. There was a second one, which the recommendation of the Epidemiology and Surveillance Unit under the Ministry of Health. They said that there should be 2 complete incubation cycles. We've completed those 2 complete incubation cycles. When you speak about NPI, those are non-pharmaceutical interventions, and those are the things of which we use to manage this. And I think that we can effectively maintain our social distancing and get some economic activity going again while not risking a massive increase in the virus. So I think that Bermudians can balance the 2 things. I don't think that Bermudians are going to run out and run over to the houses and have house parties like some of the things we saw on social media in Chicago with lots of people in the house closely packed together without masks on their face. I think that Bermudians are going to be smart because we want to recognize that if we do have another flare up and another outbreak, we might have to go back to where we are. And that was some of the things that was outlined in the modeling, that if you have a place where you start going up again, you have to bring it back. But by and large, I think that we've managed to do this portion of suppression well. And now we're just going to have to go to a phase where we're going to have a balanced approach to this. But I do not believe that I just don't think it's wise to engage in a policy, which some countries have done, of complete elimination of the virus. I think that the economic, mental, and emotional costs of that will far outweigh the health benefits.
The Bermuda model on Friday suggests the virus can't be eliminated, but rather it must be carefully managed. Is this the government position?
I couldn't hear you, John. I'm sorry.
Sorry. The Bermuda model on Friday suggests the virus can't be eliminated, but rather it must be carefully managed. Is this what the government believes?
Well, I think that every government probably recognizes it cannot be eliminated unless we decide, I recognize that we live on an island, that we're going to close off our borders indefinitely and never allow any type of transport or commerce coming into our shores. I think that's unrealistic. But what we can do, as the modeling suggests, is to ensure that we have proper mitigations in place to help to mitigate against the spread of the virus, such as the continuation of our social distancing, our hand hygiene, utilizing the wearing of masks in public places and the like. But in order to completely eliminate the virus, we would have to remain as an isolated country. And I'm not sure that that's something that anybody would want to do, particularly when we look at the cost analysis and the impact that it would have adversely on our economy.
No person's been listed recently on the official stats as self-quarantined. Does this mean that all the staff who work at Matilda Smith Williams and Westmeath are quarantined within the homes or government quarantine facility under public health supervision? What is their status?
All of the persons that are on quarantine would either be quarantined at their homes, or alternatively, those persons that would have entered Bermuda, I want to say after the 22nd of March, but I can't remember when the COVID 2020 order came into place that required every person entering into the island to quarantine at a government facility. So they would be listed as being quarantined on a government facility as opposed to home quarantine. Those persons that would have come into Bermuda prior to that, such as children that were coming home from school in the early March, prior to the borders being closed, would have been on home quarantine.
This evening, a large Princess cruise ship can be seen off the South Shore. It looks like it's caught you by surprise too. It's a Bermuda registered ship. Obviously, they haven't been in contact with government about making provisions for docking or anything.
That is news to me. I will say, Minister, do you know anything about this? Minister, do you know anything about
That's
this?
the one that's in stock.
Is it? I'm not sure. That I'm not entirely certain about. I know that there's a discussion on cruise ships that's going to take place in the cabinet meeting tomorrow, but I was not aware that the cabinet, I do know that the cabinet has not given permission for any cruise ship to dock in Bermuda. But I do know that there's been a number of cruise companies that have reached out to us. People are looking for places to dock ships, and it's a question of whether or not you can actually mitigate any risks as taking place. But that is not a decision that the government has come to at this point in time. And I know that's going to be one of the considerations of which are going to be discussed tomorrow.
All right, thank you.
No problem, Don. Thank you for your questions.
Good evening, Minister. Aaron Hill on behalf of Burr News. Can you please provide an update on how many hospital beds and ventilators are currently on island and how many are occupied / in use?
I don't have the exact figures. I would invite you perhaps to review the report of Dr. Richmond, who was here last week, I think Monday actually, who provided all of those details insofar as both the level of preparedness as the number of ventilators, the number of extra hospital beds that have been ordered and received, as well as what their contingency plan is with respect to ensuring that they have sufficient oxygen generation for persons that would require it. I do believe, so I don't want to speak out of school, so I don't know the number exactly, but it was last week, Monday, that Dr. Richmond was actually here. He's been here a couple of times, but certainly I think as recently as last week, he presented and was able to provide full details of the level of preparedness of the hospital.
If I may just add something to that, Minister, and I think that's a very good question. The minister did say those matters were discussed at the press conference last week. But earlier today, there was also a meeting which was convened by the Minister of Health, which is a high-level advisory team. So as a minister, persons from the hospital, as well as Dr. Desiree Spriggs, who runs Helix Labs, and also Dr. Karika Weldon and myself. We're discussing a number of issues regarding testing and other particular matters. One of the things which was most interesting and what was important, and as I had said when we went over the preliminary modeling information, is what exactly is that threshold where the hospital will say that we will have a problem. And the threshold of which they had indicated to us is 5 hospitalizations per day for persons with COVID. Anything above that will mean that the hospital will begin to become overrun. And anything below that means that they will be able to handle that particular capacity. We're not going to push it all the way to 5, but we're going to discuss on how we're going to manage that. I do know that there was a report that came in today or yesterday, so it might be days old data, but I do know that out of the persons that are hospitalized, 4 are in the intensive care unit and 3 are on ventilators.
I appreciate that. Minister, can you undertake by the next press conference to provide us a precise update as to the exact numbers?
I can do that.
Grateful. Minister, can you inform the public how much is each testing lab being paid by the government for COVID-19 testing, and on what basis? So, for example, are the tests by Helix and the Southside facility being done under a set contract per test, or is it a flat fee?
That question was actually asked on Friday with respect to Helix, and I don't have that information. That would have been something that would have been negotiated with the ministry, but obviously ministers don't get involved in contractual basis. So I really don't have that information. I can
Sure.
undertake to get that as well.
Grateful, Minister. Minister, it's noteworthy.
I think you would have heard me inside of my statement that in the process of which we're using at the molecular diagnostic lab, we are doing it in a different fashion, especially when it comes to public sector workers. And I think that's important because you recognize that we all as taxpayers pay taxes for the services that are provided by the government. And if you look at the instance of the government employee health insurance program, if we were going through a process where all of these things were paid for in the traditional way of a $300 bill to the government employee health insurance program, that affects all of us. We are doing this under a different setup where we are paying persons on an hourly basis who are working there and processing the results of the lab versus a fee for service basis, which is each test we build at $300. So this one is more efficient. But as the minister said, she's undertaken to get that particular information, and we can make sure that's applied to burners.
Grateful. Minister, last question for you. A few times during the course of the press conference, and it's understandable because it's a lot of information in the process, you've said that you don't have the information to hand. I note that during the other press conferences, the CMO, the Chief Medical Officer, had been present. She wasn't present during the last press conference. She's not present today. Is there any reason why? Do you know?
Why she's not present?
Yes.
Oh, there's probably a host of reasons. She's extremely busy, as you can appreciate. And the amount of time that would be taken out of her schedule to attend a press conference every day, we've only reverted to the 3 times a week just last week. So for several months, we've been coming Monday through Friday. When there have been issues that we thought that would probably be more pressing and pertinent for her to attend, then she is present. However, regrettably, well, I don't want to say regrettably, but she does have quite a big responsibility that she's dealing with right now, as you can appreciate, and coming to a press conference effectively takes a couple hours out of her day. If there are particular questions, we do attempt to answer them as quickly as possible. It is unfortunate that sometimes we get questions that are, 4:30, 5 o'clock, expecting for them to be answered, and we're getting ready to come to a press conference. So that's a little bit unrealistic for those to take place. But at the end of the day, Dr. People is extremely busy and attempts to answer questions as much as possible if they're presented to her in a sufficient time for her to return those questions. The answers to those questions, but she can't. I wish we could clone her because she's obviously very, very valuable, but for her to sit at a press conference, as opposed to being in the office trying to deal with the important issues of ensuring that we have our testing capabilities, particularly as it relates to the contact tracing for our rest homes, which the Premier has directed that all rest homes be tested. So she's in the process of finalizing that process as we speak. So I think it would have been more valuable for her to continue that exercise as opposed to be in the company of you good people.
Grateful, Minister. Mr. Premier, this question is for you when you're ready.
Go ahead.
The Bermuda government modeling from Public Health England estimates a possible worst case scenario of 718 deaths and a better case scenario of 263 deaths. However, you've determined, quite optimistically, that on May 2nd, we will reopen, albeit with regulations. So is it correct to say that the government could potentially reduce the estimated number of deaths for the better case scenario by maintaining the shelter in place longer? And if so, does that mean that the government has accepted that 263 deaths as the acceptable middle ground as opposed to keeping everything shut down for a longer period?
That's a very good question, Aaron. It allows us to discuss a few things. I think that when you look at the modeling, I think what the minister has indicated is that modeling will change. And one of the things that I want to do with the modeling, the minister is going to hand over the data per se. And one of the things which I want to do is not just the PowerPoint slides, but the data behind these individual models. What I did mention earlier that I've asked Dr. Oh my goodness, his name skipped my head now. The mathematician, Kevin. Gosh, I think it's Kevin Miners. Did I get it wrong? Yeah, Dr. Kevin Miners and also Aaron Evans, who've been asked to assist in that modeling. But one of the things we also want to do is we want to put that modeling online so that any Bermudian can go ahead and play with those particular models and look to adjust them themselves. What I would say is those models are changing. It's known about the virus. Those things are done from assumptions. They're done from assumptions that a certain percentage of the population which contracts the virus, out of that percentage of the population, those persons are hospitalized. Out of percentage of those that are hospitalized, those persons then require critical care, and out of percentage of those who have critical care end up passing away from the disease. If, for instance, you have less persons that actually require hospitalization, and as some studies are showing around the world where there is a greater incidence of persons, and so there's lower hospitalization rates, then those numbers may be able to be adjusted down as well. So it's going to be a continued tweak. But at the premise of your question, you were asking whether or not the government has accepted that 263 deaths will happen in Bermuda. To answer your question very clearly on that, no, we have not. And we are going to make sure that even on the better case scenario and all the rest, that we are going to have the interventions which are necessary to prevent that particular outcome. And we're going to try our best. So there's a lot of things that factor into that. And so as time goes on, we're going to be able to adjust. And as you take a look at what happens in the hospital, et cetera. And as I said, that threshold, which was mentioned inside of the models, right now for the hospital is looking at 5 admissions a day. So we want to make sure that we can maintain social distance, that we can keep making sure that we aren't having large scale transmission of the virus inside of our community while balancing that against the economic work.
Grateful, Premier. One more question for you. The United Kingdom government has announced that it plans to borrow upwards of 225 billion in order to compensate for the losses in the economic fallout relating to COVID-19. Can you outline what, if any, relief, financial or otherwise, Bermuda has received from the UK and or requested from the United Kingdom?
Well, I do not know if we'll be making any requests to the United Kingdom. That would be extraordinary. Insofar as assistance received, I do believe that the Foreign and Commonwealth Office has gratefully subsidized and underwritten the relief flights which have come in, and also the repatriation flights. So I'm grateful for the Foreign and Commonwealth Office for underwriting those particular costs. I'm uncertain as to whether the testing kits which are being provided through Public Health England are being provided at free of charge, or we're actually paying for those. I have to necessarily confirm, and also regarding the other items, I'll get back to you on that because I don't know if we're paying for them or if they are being given. But I do not believe that the government will be looking to the United Kingdom for assistance. That would not be consistent with the way that the government of Bermuda has been run and operated in our 51 years, or coming up to 52 years now, since our 1968 Constitution.
Grateful, Premier. Those are all my questions.
Thank you.
Evening. My first question is for Minister Kim Wilson. Out of the first, well, the only one positive case today, how was it transmitted?
It is still under investigation. What we do is, hang on one moment. Actually, we received the report today, so it's still a very new and live case, and so it's being investigated insofar as the contact and the investigation. So it's still quite early days. It just was received this morning.
Thank you. And for all those in the hospital right now, what are their statuses at this moment?
I don't have the in particular details, but I can say of those 13 persons that are in hospital, 4 are in intensive care unit.
And my next question is for the Honorable Premier. Is there any scheduled incoming flights coming to Bermuda housing students?
Right now, no, there are no scheduled flights. For flights that leave from America, private planes that leave from America, we alert persons inside of the United States so that they may be able to get on those flights that are empty. And there are returning residents and students who do go back on those flights. Unfortunately, there are a number of persons which are still stuck in Canada. I did see some notes, and a question was asked whether or not we're looking at flights from Canada. Unfortunately, because of the way that the travel restrictions are happening between the US and Canada right now, I can't even let Canadian students in Canada know about flights, private jet flights, which might be leaving from the United States to go ahead and come here, as that is a particular challenge. And then we still have 170 persons that are looking to return home. One of the discussions which is going to take place tomorrow, and we do have a cabinet paper from the Minister of Tourism, is speaking about the reopening of the airport and what that looks like and the restrictions around that in consultation with health and how that looks. We do know that there are scheduled commercial traffic that is scheduled for the days that we're still in shelter in place, which may be unlikely. But by Wednesday, hopefully we'll be able to have a full update on that. But we will look to try to get flights running at some point in the future. But if I were to just give you off the top of my head, I think that as many other countries have said, it's unlikely that that regular traffic may start until June.
Okay, thank you. And actually leads into my next question is what discussions will be held during Tuesday's cabinet meeting that we can expect to be updated about on Wednesday?
Sorry, one more time.
What discussions will be held during Tuesday's cabinet meeting that we can expect to be updated about on Wednesday?
Well, we have a rather robust agenda. Papers keep getting added all the time, so it's going to be a pretty big one. But we're having cabinet papers that are coming in from all various ministries that are detailing the reopening plans. I would like to, as I said, come out of shelter in place on the 2nd, and so we need to make sure that we're talking about how the government may be able to operate after we come out of shelter in place. What are we looking in so far as the government operations, school operations, public transportation operations, all of those various things that have to be factored. The airport have to be factored into what it is that we are looking at. So that's going to be the full-scale discussion. Following those discussions and the resolution, the hard-working communications team of the government, led by Minister Jamal Simmons and Director Aderonka Badamosi Wilson, will then get to work on putting together all of the various items so we can relay them in a clear and concise manner for our press conference on Wednesday, where we intend to lay out, if not a full plan over how the next month will work, because it might be too quick to judge what might happen. But I think at least a plan for the next 2 weeks so that business owners have time to plan and have an expectation of what they may or may not be allowed to do.
Okay, thank you. And my next question is for Minister Keynes, is how many or how can persons who work out of home apply to open?
I'm going to share the information. They can just go on our website and fill out the form, and the team will consider their application.
Thank you. And also one other is that last week you said Thursday that many people will be checking on the approved permitted businesses. How did that go, and was everyone up to standard?
There were a number of people that were given, were not allowed to enter to open, but there were 103 businesses that were considered and now are open.
But did your government go check on those businesses, like go to each and every business like you said?
Absolutely. Well, not each and every business, but what we've done is we've asked the traffic wardens to go through the city to look and to make sure that everything is fit for purpose. And so if you go around the city, you will see the traffic wardens looking at specific businesses. We're in the final stages of getting permission for the bailiffs to join the cadre of people that are going around. And so at every element, we are making sure that people understand that, number one, we have some provisions that have been put in place, and it's critical that they follow them. We have the traffic wardens and the bailiffs who will be policing this process to make sure that people are following it. We've also made a complaint line where people, if they see someone that is breaching any of the regulations or if they're not following this, where they can make complaints as well.
Okay, thank you.
Thank you very much, Ms. Palacio. Before we go, Aderonka, to the next person, I have received an update. Don, you made me feel I was completely out of the loop on something, so I do have it. As it comes to me, so I'm going to read it. It says, Premier, the cruise ship has a sick person on board due to a back injury. He is a dancer on board. The ship will be at 5 Fathom Hole, and the pilot boat will bring him in. The ship will remain waiting for the injured dancer. If they have to keep the male individual, a medevac from Florida will collect the injured.
Thank you very much. Good evening, everyone, and thank you very much for your time again. Fiona McWhirter from the Royal Gazette. My first question, Mr. Premier, in your statement with regards to testing at West Holmes last night, you did say that lessons have been learned. Can you give us a little bit of background as to what happened and what lessons have been learned?
It's an interesting question, and it might lead to an incredibly long answer, but I want to make sure that I'm being completely and totally transparent with everyone. In a crisis, there are always decisions that have to be made. And in Bermuda, we are in the less than opportune position, being a small, isolated country that does not manufacture our own equipment, and we are, left at the mercy of international supply chains and those particular items. The lesson I think in this that is learned is that we could have been more aggressive. And when I say more aggressive, we know that there were various shortages of various equipment. And in order to get those particular equipment and to use the equipment that was here on island, there is a reticence, of course, that persons will have, whether or not in approaching these particular situations, is if they want to use equipment which may not be, I would say, approved by the FDA or tested or other things. And that is a very appropriate balance. But the one example that I would give is that no one actually in the Cayman Islands questioned as to whether or not their testing kits were FDA approved. They were not, but they were approved from the country where they got them from, and they trusted them enough in order to use them. So I think what this has shown in this particular instance is, yes, we could have been more aggressive. Yes, and swabs did arrive in the country. Sorry, an order of 10,000 swabs were placed, and the first set did arrive in the country on the 15th. We could have actually gotten to the rest home sooner. But I think it's important to note that even if we got to the rest home sooner, it doesn't necessarily state that there would have been additional positive results. For instance, there's a question as to why, if we tested the persons at the first time that there was a particular test. Testing everyone, which is an invasive procedure, and some people have seen videos of how difficult that procedure is. If there is a test found in a staff member, and if you test everyone else that next day, give the incubation period, you might not get a positive test. And there are challenges that when you have these type of results, they may lead to different public health actions. But what the CMO has said is that the public health activity was the same, making sure that the precautions were taken inside of the homes, etc. But I think getting back to the premise of your question is that we could have, in some instances, I think, been more aggressive. We could have been more creative, and we could have made sure that all of the resources that were at our disposal could have been deployed in a quicker point in time. All of that being said, I am confident, as I said in my statement, that we've turned that corner. And I'm confident that with the testing that is taking place on Southside, with the commitment that is from the Ministry of Health to make sure that all particular nursing homes are tested. And I think the other lesson that is learned is to err on the side of caution. And that is where we are erring right now, making sure that we test all of the particular nursing homes. This is not a normal outbreak. This is not the flu. This is a very contagious virus, and it moves in very mysterious ways. And if we look at what has happened in other countries, especially in the United States, the United Kingdom, and other places in Europe, about the impacts which it has on our seniors and our rest home population, I don't think that you could be too cautious in that at all.
Thank you very much. It appears to me that we're hearing tonight that with regards to Westmeath, the testing issue appeared to be more of a capacity. We heard about swabs. I think we were lacking swabs at the time. Why then did we hear earlier that on April 10th, the details of the first case at Westmeath did not warrant testing?
As Dr. People would have said last week when she was here, they do what's called a case investigation. So if a person tests positive, then they start to commence this investigation. And if, for example, the circumstances are such that that particular person may have only been in contact with 2 or 3 other individuals and may have had no contact with, for example, residents, or may have only been in contact with the person at the grocery store. That's part of the case investigation, and that's part of the contact tracing. So following that particular exploration, if it is determined that the circumstances are such that they have controlled the virus, i.e. the person has been quarantined, any persons that have been in contact with that person have likewise been quarantined, there doesn't seem to be any type. It's a number of things that come into play with respect to the case investigation.
Thank you. And just maybe a point of clarification on your remarks earlier. Did I understand you correctly when you said there had been 4 rest homes tested so far?
Correct.
And I think you said they were the places that had cases, but that none had residents that tested positive. Is that correct?
No, I said that there are four, as I mentioned on Friday, that unless, and Dr. People had actually mentioned this as well last week, if there's a circumstance where a resident of a particular home tests positive, then for public health reasons, we will disclose the name of that rest home. On the other hand, if the residents are not positive, on the other hand, if the residents are not positive, then there's no need to disclose the name of the rest home because there's no public health issue. As I mentioned, the 4 rest homes that we've already tested thus far, 2 of them, all of the residents in both of them collectively have tested negative for COVID-19.
But were they tested because there had been staff members that had tested positive or could have come into contact?
They were tested because, like I said, the Premier had indicated that we're going to test all rest homes, which we're doing. And we started from basically a case analysis and ones that we thought were more urgent, such as a person that may have had a staff member that may have worked at another rest home where there may have been a positive.
Thank you very much. Appreciate that. With regards to the drive-through testing facility at Southside, I know obviously some large numbers have been tested there over the weekend, but I did notice that you had tweeted over the weekend that it had run under capacity, I think on Saturday. It appeared there had been a change in terms of how people would, I guess, book a testing slot there. I think initially it had been employers would arrange it for their employees. Now it seems to be that individuals can do it of their own accord. Would you mind telling us a little bit about what's happened there? If that's the
Happy
case?
to do so. And as I said, this is what you do. You learn as you go along. So we certainly had a lot of capacity for tests. As I indicated on Friday, we started a little bit late. There was a little bit of hiccups when we got started. So we got started a little bit later, but we managed to collect 74 tests on Friday. Starting about 3:30 up until 7. So that was still a good number. On Saturday, we were open from 9 a.m. until 7 p.m., but we only collected 84. We had gone through a process of allowing the uniformed services to go first. So the Ministry of National Security had basically made assignments of individual persons and said that, whether it's police, I think regiment was the ones who started, et cetera. And so when we saw that the capacity, there wasn't a change in the way that these things were booked. These things were always booked through that link, and the Ministry of National Security had that link, and there might have been page for regiments and et cetera and all the rest. But so we just decided that the fact is that we do have a lot of essential workers that need to be tested. So that day, myself and other ministers reach out to grocery stores and other persons, and I decided to go ahead and use my social media to get more persons knowledgeable about the fact that if you're an essential worker, you can go ahead and get your tests booked. Now, the one thing is, and it's a very important point to note, and I want everyone to hear, the testing process itself, as people have seen via videos, is not incredibly pleasant by any stretch of the imagination. I think, Minister Fogo, you had a test yesterday administered by your daughter. And it was certainly not a particularly pleasant experience. And I think Dr. Weldon told me that Minister Keynes promised that he was coming back. Did you get your test yet, Minister?
No, I checked it out.
He's checking out. With that much being said, once you get the test, it is only that case for that particular point in time. And so part of the conversations we had earlier when I said that there's a lot of meetings that took place this weekend. So there were discussions between various officials with the Ministry of Health and the 2 testing labs about going forward, figuring out what exactly our testing strategy is going to be, because we are going to need to have a long-term testing strategy for those persons who are on the front line. No one wants to be tested once a week, but there's going to have to be a need to do some level of screening that's going to take place. So from this perspective, this is the initial round, and part of making sure that we use up the capacity also was so that we can actually have an idea as to whether or not there is local transmission which is taking place. And in our view, who best to check than the persons who are the ones that are working the grocery stores, the people working security, the people that are, manning the roadblocks, doing all of these particular things that are outside of the community to see whether or not there is that level of transmission that exists. So we said that we certainly have the capacity. So instead of limiting the booking and just the minister going ahead and sending it out just to regiment people or sending it out to all, we just said anyone who is an essential service, as long as you have your ID or a letter from your particular essential service, you can go ahead, book your thing online and show up for the particular test. They'll take your information, fill out the form, do your test, and make sure that it's reported. One of the changes also, as a discussion that was happening between the chief medical officer and others earlier today, is that we are also changing how the reporting is going to work, because there's just a huge volume. So when we first started, the reporting only went to the doctors who requested the tests. But now these tests aren't actually being requested by doctors. And unless there's a positive case, there's no need for us to go through that process of reporting to a doctor. So we're looking to see how we can directly report those negative cases to individuals. And of course, if there's a positive case, then you'll certainly still go through either a public health official or your particular doctor. But it was just opened up just to allow there to be more persons to go through the testing, as the way they were doing it before wasn't using up the full capacity. And it certainly did work. I mean, 289 collections today and 240 thus far. All the tests, even though we have medical students who are there, all the tests are either being done by registered physicians or by or the physicians are supervising. So a vast majority of the collections are being done, because one of the places where this can mess up is if you don't do that collection very well. So you do have to get it all the way back to the cavity and then, you know, the rotation. As you've seen all the videos and all the rest, it is not pleasant at all.
Thank you very much.
Premier,
Mhm.
I will be,
and-
just really quickly, Premier, I'll be going down after cabinet tomorrow to be tested.
Thank you. And I have a question for the Minister of Labour. This is a question from one of our readers. Are you able to tell us what the unemployment figure was prior to the pandemic and what it is now?
No, I have not kept up with the change in those who are unemployed. And do understand that some of those persons who find themselves unemployed right now is because of being laid off, not because employment has been terminated, so to speak.
Thank you very much.
Sure.
Thank you. I want to thank all the members of the media for their questions today. I sincerely hope that this was enlightening. I did ask a few persons if they wanted to get questions and ask them online. A lot of those questions were in regards to the information of which we're going to be speaking about on Wednesday. There was one question which I wanted to answer for persons who may be watching from Canada about the possibility of repatriating students who are in Canada who are stuck, who can't get home. And I want to say that we are continuing to work on that particular issue. But on Wednesday's press conference, we're going to be using the Minister of Communications has said that we're going to have some additional visual aids as we walk through the steps of what our next stage in shelter in place will, after shelter in place will be. So to all of you, I wish everyone a very good night, and I would ask that the country continue to pray for those who have lost their loved ones to this virus. Thank you and have a good evening.
This is a message from the government of Bermuda.
COVID-19, otherwise known as the novel coronavirus, is changing the way we live, work, and do business in Bermuda. It's also changing the way we shop. Here are some tips for grocery shopping during the COVID-19 pandemic. Before you go to the store, consider whether you really need to go shopping. If available, consider delivery options instead.